we would be having Professor Rahul Rao to take us through the tools, various tools for going lean in healthcare, Toolbox 101. Rahul?
Yes, yes. Am I audible, Raj?
Yeah, you're audible now.
Yeah. Okay. You will be changing the slides. Okay.
I'll be changing the slides.
Yeah, yeah. So thank you, Dr. Umashankar. This was really an eye-opening presentation, and it was just unimaginable. I mean, the cost of poor quality in healthcare, which is just we cannot have afford being in healthcare and hospital industry. So I'll be talking about the various tools through which we can avoid such cost of poor quality, and I would start with why. Why we should do any of the lean tool, why we should implement in hospital. So mainly my talk would be focused on the 5S and whether many interrelated tools which are there in 5S. So I'll be beginning with why we should do 5S or any of the lean tool. So once we have a very strong why, then how, what, where, everything will follow. So this is a famous golden circle which is given by an author named as Simon Sinek. He has written many books on why. So doing why, a proper root cause analysis of things. So you can read up this, and then I'll come to next slide, please. So before implementing, next slide, please, Raj. So next is why we should do 5S. In order to understand why we should do 5S, we need to understand what is waste. So hospitals are process intensive organization. There are various processes in the hospital, right from the patient entering to the patient going for a discharge to the, I cannot see the slide. Okay, no, not this second slide, Raj. Why 5S? Previous slide. So why we should do 5S? So before knowing why we should do 5S, we need to understand what is waste. So as I told, hospitals are process intensive organization. There are various processes in the hospital, and there are various non-value added activities and non-value added activity in every process. Process is a set of interrelated activity. And suppose a patient has come for admission, he just wants to get immediate admission and get into the bed. If a patient is going for a discharge, he immediately wants to get discharged. So whatever in between is happening is not adding any value to the patient. So all these are non-value added things which we call as waste. Now 5S helps in reducing some these waste, and 5S basically started with manufacturing sector, and then slowly it has taken up into education, not-for-profit, and other government organization. So we move on to the next slide. Next slide is about the waste in healthcare. So there is a link to a video for waste in healthcare which you can refer, and you can just watch it in the various kinds of waste. And next slide, please, Raj. Yeah, next to this. So say there are 7 types of waste which are defined by Toyota. So we come in, I'll just give a one example of each of these waste and then quickly run across the other slides. So first kind of waste is overproduction waste. So overproduction is, suppose a patient has come and doctor is ordering so many tests which are not required, just to confirm the diagnosis. So that is kind of overproduction waste. Inventory waste is anything which we store in excess. We have a lot of inventory available in our pharmacy and general stores which are of no use, and then it is unnecessarily costing us a lot of money if it's not properly utilized. So that is all inventory waste. Waiting time, we are all aware there is a lot of waiting time, unnecessary asking the customer to wait. So if our process is not good. Motion also. Motion means we keep searching for the things. If our processes and policies are not well defined, we keep searching for the various things, and patients are not properly routed for a particular process. They waste a lot of time waiting in OPDs and other areas. So that is kind of a motion waste. Fifth kind of a waste is of transportation. Transportation means moving with the items. If the process is not defined, a person or a white boy or a ayah will be moving with the wheelchair here and there. He himself doesn't know where they should take the patient. So such kind of waste is known as transportation waste. Difference between motion and transportation is motion is moving with the item, transportation is moving with the item, motion is moving without the item here and there. Rework. A lot of reworks are happening. When I remember rework in the sense of quality or accreditation framework, rework means redos in lab and imaging, such quality indicators. So quality is doing everything first time right. If we are not doing anything first time right, it all becomes rework. Then seventh kind of a waste is over processing. Anything which we over process. We ask the patient to fill n number of forms because NABH assessor has given NC. So a new form gets added up and we do not know the purpose of it. So that is all over processing waste in hospital scenario. Now there is another waste which is known as unrecognized human potential. Initially, Toyota defined 7 types of waste. Later, they have added one more type of waste, which is unrecognized human potential. Human beings are one of the important resource of our organization, and there is a research estimate which says that we use only 55 to 10% of our brain. Remaining all goes unused. So that is all unrecognized human potential, and we live in a knowledge economy now, and so whenever we are possible to take the advantage of employees, their skills, it all becomes unrecognized human potential. So next slide, please. So next is, now we know what are these waste. So what do we do of this waste now? So Toyota were the ones who defined the waste, and they themselves said that 90% of the work which we do, 95% in fact, is all waste. We do only 5% of the value added activity. So it is very difficult to remove all waste. Can we remove all the waste from the process? We cannot remove it. It is practically impossible. So what we do in that case when we cannot remove the waste? So next slide, please. So there is a framework known as ECRS framework, where we eliminate and we combine certain steps wherever possible. Remember, ECRS framework: eliminate, combine, rearrange, and simplify the process wherever possible. So this is known as ECRS process, through which we can reduce waste. It can be applicable to any process, whether you consider a discharge process or admission process or your operation theater process. You try to eliminate wherever you can do waste, and you combine and rearrange certain activity and try to simplify the process. There are various other tools also, like I'm talking about 5S or Lean Six Sigma or value stream mapping. All these tools try to cut down the waste from the process. No, next slide, please. So this is an example of a value stream mapping in a hospital. Next slide, please. So value stream mapping is nothing but we do a process flow and we try to eliminate all the non-value added activity in the process. So I come into, there is a saying that many people when they go for a hospital and they visit various industries, they see that hospital is very beautiful because of 5S. A lot of labeling is done, everything is very smooth, but we should remember that we should never do 5S for beautification sake, because it's a lifelong process. It is a continuous quality improvement journey. No, you cannot consider that you do it for 2-3 months and add some things and keep on doing it. It's a continuous process. It has to become a part of your culture. So please do not do 5S for beautification sake. Now, what is this 5S? Now, this is a very simple definition of 5S: keeping the workplace organized, free and clean clutter at all the times. Now, important thing is workplace. Every place in the hospital is every place. I mean, if I'm sitting here, if I'm working, this is my workplace where my laptop is. For you, where you are sitting, where you are working. So it is very difficult, though the definition looks so easy, it is very difficult to do it at all the times. No, sometimes it is difficult to do easy things if daily it is asked, but it is easy if someone gives a difficult, challenging work, we do it in one shot. We think that, okay, we'll take it as a challenge and do it. So it is doing it all the times. Now, next slide, please. So next slide is about the 5S. So what are these 5S? Now, first is known as sort. Now, each of these S looks very easy in the diagram, but there are various concepts which are very fascinating if we look at it: sort, set in order, third as shine, fourth standardize, fifth sustain. So there are various concepts. Now, I'm not going into the detail of these concepts, but I'll just explain you a simple, give you a simple explanation so that we move on to the subsequent slides, and I'll be giving you the reference which you can refer for more detailed information on this. So first is sort. What is sort now? So anything which is of no use, we move around the hospital and we see what is of use and what is of no use, and we just try to take a decision whether we want to discard it or eliminate it. Second is set in order. Set in order means there is a simple acronym with which I remember: a place for everything with everything in its place. If I want to search something, I can immediately search it. If surgeon is in the operation theater, he can immediately get whatever he needs. So that is like set in order. Place for everything with everything in its place. Third is shine. Shine is nothing but keeping the workplace clean, but it is not simple cleaning. It is cleaning with a inspection and detection mindset. Fourth is standardize. It is ensuring that all these three S are followed. And whenever I remember standardize, I remember NABH policies, SOPs, procedures, guidelines. Fifth is sort. Sort means ensuring that everything, all of these four are followed and this field is properly moved. There are various tools again. So in the link which I have given, you can refer all this for a very detailed explanation. And we have done one more webinar also on roadmap to implement 5S in hospital, where a detailed explanation of which is given, and you can refer that. Next slide, please. So there are various no Indian words for this. So we say sort, set in order, shine, standardize, and sustain in Indian words. The pronunciation of these Japanese words. Next slide, please. So there is a concept of Poka-yoke, which we call. Now this is a part of second S actually. Second S is we should not search for things, but Poka-yoke is a concept which says that design your process in such a way that you need not search. I mean, you need not do any defect only. So let us see some of the simple examples here. So this is an example of a file in our account department, and where you can see the next slide, please, Raj. So where you can see the mouth of the fish, the mid portion of the fish, and the tail of the fish. So if anything is removed here, we will easily know what is done. Like that, there are many concepts. This is one of my favorite actually. So I've included this in the presentation. There are many concepts in each of these S, and every concept is in itself a big project to implement. So next slide, please. So next, you can see a various files which are arranged, and it's a vertical stacking. Anything we store in a vertical order. So if we remove everything, we will come to an example of another interlinked quality tool, which is known as Poka-yoke. These are just tip of the iceberg. One or two photos. There are some more than 130, 140 implementation. If you go into the detail, and I'll be sharing you the link now. Next slide. There is also a need for audit now. So fourth S, no, which says standardize. There is an audit. Like we do an NABH audit, there is audit for 5S also. How to do audit now for a 5S? Let us see. Now there is a saying that machinery, man, or method, if left alone, tend to deteriorate. So we have to monitor it. So how do we monitor it? So next slide is next slide, please, Raj. Next slide is about auditing. How we can audit 5S and NABH together in a hospital. So this is a checklist. Next slide, please, Raj. So this is a checklist which says there is a check item for 5S. I mean, each S there is a one checkpoint, and then there is a NABH and 5S. So everything you can combine it. Many people ask this question: is there any ready-made checklist which is available which we can use and do it? So it is not that simple. You have to use your brains, and you have to use your potential, so that unrecognized human potential waste doesn't happen, and you can create your own checklist based on this. Some of the sample audit checklists I have shared here in the presentation. You can refer into the link which I'll be sharing towards the end. Next slide, please. So next slide is basically about Kaizen. So Kaizen is also a part of fourth S. Kaizen means a small improvement which can be done. There are various examples of Kaizen in hospital which can be done, and lot of money can be saved in lakhs and crores of rupees, which is all a part of 5S methodology. For the sake of the lack of time, I have not included this, but it is in detail given in the presentation slide, which I'll be sharing along with the YouTube video. So there all we can do 5S. Many people say that we have very small hospital, or they say we have very big hospital, whether we can do 5S. So 5S can be done anywhere, any place, anywhere. So let us see, for example, even you can do it in your mobile also, for the ease of understanding. Forget small, bigger hospitals. Next slide, please, Raj. So next is about how we can do 5S inside a mobile. So inside a mobile itself, you see, first as is about sorting how many unwanted files you have. Daily you get a lot of WhatsApp forwards, videos. How you can eliminate it. In sense of hospital, a lot of letters are coming, a lot of mails are coming, which might not be of any use to you, for the hospital administrator or the quality manager. Sort it out. That is first step in simple words. Second is set in order. So create files, folders. If you want to search anything within 30 seconds, you should be able to search it. That is how you will avoid motion waste. Third is about shine. So how we are cleaning it, how you can clean and save space from your mobile. Not only external cleaning, internally also there are many apps available. Fifth is standardized. So what is your backup plan, and how do you update your phone? That all comes under standardized. Fifth is sustain. So how, whether the mobile is helping you to do something productive, or every time you are busy in WhatsApp and you are not doing anything, and from morning till evening you are sitting there. So that is how it is sustenance, whether the mobile is adding some value or it is just distracting you. So the next slide, please. So we move into the deeper meaning of these five S's. Next slide, please.
Two more
So
minutes. Two
next,
more minutes, Rahul.
yeah, no problem. I'll just finish it up. I'm coming towards the end only, just 3 to 4 more slides. So first, deeper meaning of first S is we give respect to space. You can save space in so many in amount, millimeter, centimeters, and so many. I mean, space can be saved. Time, second is respect for time. Anything you want, you can easily retrieve. Third is workplace. So we do Ayur Puja and various pujas and all to show that we love our equipments. No, that is again like a shine methodology. Fourth is safety. Many people say that there is sixth S, which we call as safety. So what is this safety? I mean, so safety is a part of fourth as only. When we standardize things, it is for safety only. Please remember. Fifth is Shitsuke, which we call sustain in Hindi, in English, and it's like for the society. If you are doing something for the society, when I implement 5S, I teach others how to do it, and there are various competitions which are held. So we go and we learn. So these are various references available, and Salem Gopi Hospital is one of the hospital which has done an excellent implementation of 5S, and Ashok sir has been very kind to share this, and we have given a lovely good presentation which received a very good feedback on 5S. So you can refer to all these. These are the links where you will get all these. Now I come into the question which I asked in the beginning, why we should implement 5S. So why it is, because we want to reduce inefficiencies, and we want to, every penny saved is every penny profit added, like the Dr. Umashankar told in the beginning of the presentation. So inefficient people will all lose jobs, and inefficient businesses are all going to vanish, because after COVID, every business has to change their business model. Next slide, please. There are some references which are left. I'll quickly run through that and just end my presentation. So how you can start off with 5S. Now this is a 1S activity which was carried on. And next slide, please. Next slide is about how you can link 5S to NABH. So each of these 5S are linked into NABH standards in the following way. You can refer this: sort, set in order, shine, standardize, sustain, and you can read it. It's very fascinating to know about this, and in case you need more details, you can refer the presentations. So if the hospital is divided into number of zones, there are various zones, 20 zones. The hospital was divided in number of subzones. Every zone will have a leader and sub leader and a 5S champion, and this activity goes on. Next slide, please. This is an example of an improvement zone board in the hospital, where monthly auditing is done and the scores are monitored by the staff. Next is a Obeya wall, or we call a Japanese war zone concept. So this is done in one of the Salem Gopi Hospital's picture, where all your KPIs, visual control, is a part of second S. So all these are done now. Tendency is like, because of COVID, we cannot do stand-up meetings, so it is all moving digitally. Next slide, please. So what can be the roadmap to implement 5S in the hospital? So these are some of the things. Hospital started its journey in the year 2016. Then, like, there are entry-level standards. There are frameworks available in 5S also, where you can move to various awards: gold award, platinum award, and levels also. So there is sustenance level, model level also. In India, I don't think any hospital has reached to the level of model till now, but some hospitals are trying, and soon they will reach to that level. So if you want to do 5S at home, there are some of the next slide, please, Raj. TQM. So 5S is the foundation for total quality management also. If you are doing your 5S well, you can easily move into TQM. And currently in India, there are two organizations which are into TQM. First is IMC Balakrishna National Award. Second is CII. They have their framework which are based on Malcolm Baldrige rating, which was very nicely explained by Mandakini madam. So 5S is just the basic foundation for this. So start somewhere, don't keep on postponing. Start somewhere. Like quality is it's a journey. You start somewhere. And I would end my presentation with some of the workplace home references. So if you want to walk the talk, you can implement 5S at your home also. And there is a reference given by Marai Konda on Netflix. If you type, next slide please, Raj. So if you type it, you will get the link. You'll get a beautiful video. In fact, I'm trying to implement it at my home also, and I have done a lot of implementations of 5S in my home also. In case you want to have workplace references, please refer, next slide please. Please refer these three organizations references links which are shared here. So ABKOTS, QCFI, CII 5S award. Why organization go to award? Because they learn a lot of good practices from others, and that is an important aspect of 5S. So these are two books, and these two books are just like a Bible in itself of total quality management and 5S.
Thank you,
So
Rahul.
with this,
Go ahead, complete.
I and any questions we can just take it out in the panel discussion. Thank you so much.
Yeah.
Thank you, Raj. Thank you.
Thanks, Rahul. That was really an express
Thank
toolbox training to all of us. And really appreciate the way you connected the 5S with NABH. One of the things, because in India, all hospitals actually go for NABH. But if, as also Mandakini madam said, the linkages are important. Between all these various accreditations, there are linkages. So if you can map all those, you are all in good place, and you will get to a good shape, and organization would be a very quality compliant organization. You will actually start going beyond. So to give us